This is an important subject as this is Cervical Cancer Awareness Month. And I know a lot of people are concerned because there's more and more hospitalization going on with cervical cancer. So I'm going to be going back and just cover a few of the items that I covered last week. And that would be some of the risk factors. So bear with me. So some of the risk factors that we discussed last week, I just want to go through quickly, is age, socioeconomic factors, oral contraceptives, and exposure to a pill called DES, especially if you've had mothers that have taken this medication during the 1940s and 70s, you're at high risk for cervical cancer. Some of the other causes we talked about, again, taking oral contraceptives for a long time, unhealthy lifestyle and diet, having several sexual relationships, sexual partners, smoking, having the HPV virus, other sexually transmitted infections, and having intercourse at an early age. So for those of you that don't know, cervical cancer is one of the sexually transmitted cancers. It is not the only reason why people get cervical cancer. So please do not misunderstand that. So let's go into your screenings. Screening is used to discuss precancerous changes or early cancers before signs and symptoms of cancer occur. Scientists have developed and continue to develop tests that can be used to screen a person for specific types of cancer before signs and symptoms appear. The overall goal of the screening is to reduce the number of people who die from the cancer or completely eliminate deaths from cancer, reduce the number of people who develop cancer overall. The following tests and procedures may be used to screen for cervical cancer. The HPV test, the human papillomavirus test, and this is a test that they test to see if you have the virus that could start cancer, and this is the sexually transmitted part of it. A Pap test. We need to make sure that you're doing your Pap screening, that you're following up yearly. I know over COVID, a lot of people missed a lot of their screenings, and in the end, 3 years later, have had metastatic cancer because they missed screenings. Visual inspection with acetic acid. The visual inspection with acetic acid is a screening test that can be done with a few tools and the naked eye. During the visual inspection of acidic test, a dilution of white vinegar is applied to the cervix. The healthcare provider then looks for abnormalities on the cervix, which will turn white when exposed to the vinegar. This screening test is very useful in places where access to medical care is limited. How cervical cancer is diagnosed? Again, there are many tests. The type of cancer is suspected. They will depend on the test that the doctor will be considered, your signs and symptoms, your age, and general health, results of early medical tests. Cervical cancer is diagnosed again using the Pap test, a colposcopy. The doctor may use a colposcopy to check the cervix for abnormal areas. He or she may also do a biopsy, which is the removal of a small amount of tissue for examination under a microscope. Endocervical curettage. This is the doctor wants to check in an area inside the opening of the cervix that cannot be seen during a colposcopy. And then this is called a LEEP. Uses an electrical current passed through a thin wire hook. The hook removes tissue for examination in the laboratory. The American Society of Clinical Oncology recommends that all women receive at least one HPV test at a minimum to screen for cervical cancer in their lifetime, with general frequencies between every 5 to 10 years. Specific recommendations may vary based on your age and the resources available in the area where you live. So talk to your doctor about how often you should be tested. Now we go into staging. If a person is diagnosed with cancer, there becomes a staging part of it. Staging is a way of describing where the cancer is located, or where it has spread and whether it is affecting other parts of the body. Doctors use diagnostic tests and physical examination to find out the cancer stage. So staging may not be complete until all the tests are finished. Knowing the stage helps the doctor recommend the best kind of treatment and can help predict a patient's prognosis, which is the chance of recovery. There are different stage descriptions for different types of cancers. For cervical cancer, the staging system developed by the International Federation of Obstetrics and Gynecology is used. Staging is based on the results of a physical exam, imaging scans, and biopsy. Here are some of the stages. So we have stage 1. Stage 1, the cancer has spread from the cervix lining into deeper tissue, but it's still just found in the uterus. It has not spread to other parts of the body. This stage may be divided into smaller groups to describe the cancer in more detail. And so they have what's called stage 1A, 1A1, and 1A2, and stage 1B as well. And this describes the centimeters of the cancer. Stage 2, the cancer has spread beyond the uterus to nearby areas, such as the vagina and tissue near the cervix, but is still inside the pelvic area. The cancer has not spread to other parts of the body. This stage may be divided into smaller groups to describe the cancer in more detail. Then you have stage 3. The tumor involves the lower third of the vagina and or has spread to the pelvic wall, causes swelling of the kidney, called hydronephrosis, stops the kidney from functioning, or involves regional lymph nodes. Lymph nodes are small, bean-shaped organs that help fight infection. There is no distant spread. And here are pictures of what that looks like when they have the stages. Stage 1 is still here, it's still encapsulated here. Stage 3, the disease is in the pelvis and the lower part. And stage 4, it has now spread itself. Stage 4A, the cancer has spread to the bladder or rectum, but it has not spread to other parts of the body. Stage 4B, the cancer has spread to other parts of the body. The treatments for cervical cancer. If your doctor suspects that you have cervical cancer, he or she will refer you to a gynecologic oncologist, a doctor who has been trained to treat cancers of a woman's reproductive system. The doctor will work with the individual to create a treatment plan. Cervical cancer treatments include surgery, chemotherapy, and radiation therapy. Surgery, the doctors remove the cancer tissue in an operation. Chemotherapy, using special medicines to shrink or kill the cancer. And radiation, using high energy rays to kill the cancer. What are some questions you may want to ask your doctor if you hear those words that you may have cervical cancer? Or questions you can typically just ask a doctor if you have any concern. At what age should I start being screened for cervical cancer? Should my screening include HPV tests? If so, how often? Why are you recommending these specific tests and the screening schedule for me? At what age could I stop being regularly screened for cervical cancer? Do any recommendations change if I have had cervical dysplasia or precancer? Do any recommendations change if I have the human immunodeficiency virus, HIV? Do any recommendations change if I have had a hysterectomy? Do any recommendations change if I am pregnant? Do any recommendations change if I have had the HPV vaccine? And what happens if the screening shows positive or abnormal results? Everyone should talk to their healthcare team about cervical cancer and decide on an appropriate screening schedule. For people of high risk for developing cervical cancer, screening is recommended at an early age and more often than for people who have had average risk cervical cancer. Key statistics for cervical cancer. The American Cancer Society estimates for cervical cancer in the United States for 2023 are about 13,960 new cases of invasive cervical cancer will be diagnosed. About 4,310 women will die from cervical cancer. Cervical cancer precancers are diagnosed far often than invasive cervical cancer. Hispanic women have the highest rates of developing cervical cancer, and Black women have the highest rates of dying from cervical cancer. Cervical cancer was once one of the most common. Cervical cancer death rate has dropped, however, significantly because of Pap smear and having your Pap test done. So please know, ladies, it's important that the screening procedures are done on a yearly basis. If in recent years, the HPV virus test has become approved for another screening test for cervical cancer, since almost all cervical cancers are caused by the HPV virus. The HPV test looks for infection for high-risk types of HPV that are more likely to cause precancers and cancers of the cervix. The HPV test can be used alone or at the same time as a Pap test, called a co-test. Cervical cancer is most frequently diagnosed, again, in women between the ages of 35 and 44, with the average age of diagnosing being 50. It rarely develops in younger women, younger than 20. Many older women do not realize that the risk of developing cervical cancer is still present as they age. More than 20% of cases of cervical cancer are found in women over 65. However, these cancers rarely occur in women who have been getting regular tests to screen for cervical cancer before the age of 65. Should you need further information on this, you can also go to the American Cancer Society Statistics Center. And these are just some other statistics that I've just discussed. The support groups that are available if someone should be diagnosed with cervical cancer. The National Cervical Cancer Coalition, in partnership with Inspire. You have sharecancersupport.org, mskcc.org, survivor.org, foundationsforwomen's-cancer.org, cancersupportcommunity.org, and the American Cancer Society. I want to give special acknowledgement to cancer.net, mskcc.org, cancer.gov, the CDC, as well as the American Cancer Society. Should you have any questions about what I've already discussed, please join us in the Zoom room. I'll be happy to answer those questions for you. God bless you and enjoy the rest of the service.